Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et le Premier ministre, l'Honorable Blaine Higgs. Speaking on behalf of the province today are Dr. Jennifer Russell, the Chief Medical Officer of Health for New Brunswick, and the Honorable Blaine Higgs, Premier of New Brunswick. There we go. Dr. Russell.
Everyone, bon après-midi.
Hello, everyone. The COVID-19 pandemic has stirred many emotions in us. This unprecedented situation has left many of us feeling confused, anxious, or fearful and grieving. It's normal. Some may also feel angry or vengeful. These are feelings that we all feel sometimes. It's natural to feel this way when we are confronted by events that are beyond our control. There are some things we can control, however. We can choose how we respond to these events. That's something we can learn in this situation. We can all learn something.
With understanding, forgiveness, and compassion, we can offer support to our fellow New Brunswickers when they need it most. We can make choices for ourselves that we might not have made a few days ago or a few months ago. There are 25,000 of our fellow New Brunswickers living in Zone 5, which includes Campbellton, Dalhousie, and all communities between Whitesbrook, Kedgwick, Saint-Jean-Baptiste, and Belledune. They are today dealing with a new outbreak of COVID-19, which is putting significant stress on everyone, and perhaps even elsewhere in the province, as we know that some people could have traveled outside of that region. Measures have been taken to control the spread of the disease, which includes reimposing restrictions that other New Brunswickers are no longer subject to. And I understand this is very upsetting for the people of this region, but now more than ever, they need to support each other, and we need to support them. Today, there are 3 new confirmed cases of COVID-19. Again, the new cases are all in Zone 5, and I would expect, based on the contact tracing and the testing that we're doing, we will see more cases. Our preliminary investigation of these cases has confirmed they are linked to the 3 active cases in the region, originally traced to travel. Les nouveaux cas sont répartis comme...
The new cases are as follows: an individual aged under 19, an individual aged 40 to 49, an individual aged over 90. The outbreak in Zone 5 is upsetting to everyone, including me.
Of this outbreak were completely preventable and happened in spite of all of our efforts to keep the virus at bay. I wouldn't necessarily say completely preventable in the sense that we need to always be aware of what our actions can do to contribute to more cases of COVID-19. Our borders are not completely closed. We know we have people coming across every single day. So each individual New Brunswicker has to make sure that they stay 6 feet away from other people and wear your mask when you can't do that. So in every single situation, every single day, ask yourself these questions. Am I doing everything I can to protect myself and my community? They show how utterly forgiving the COVID-19 virus can be and how easily new cases can arise because it's invisible. People have been transmitting who don't have symptoms at all, and that's the part that's really challenging for people, to not be able to see it. You can't see COVID-19. I do want to clarify the current policy around healthcare workers traveling outside the province. If any healthcare worker living in New Brunswick and working in a New Brunswick healthcare facility leaves the province for any reason whatsoever, it is mandatory that they self-isolate for 14 days upon their return. In this situation, everyone deserves our compassion. We are in this for the long haul. No one set out deliberately to bring the virus into New Brunswick. Again, we can't see it. So you don't know that you've been exposed. You don't know that you have it. Given what we know of the virus, a person contracting the illness may not be aware of it for several days, a period in which the virus can spread to others. So the whole business around having bubbles and close contacts and people that you love, that you want to be around and socialize with, you have to be very choosy about the number of people that you let into your inner circle, literally. So your distance around you, you really, really, really need to be very careful and very aware of that at all times, and make the decision to put the mask on when you know you can't socially distance or physically distance with the 6 feet distance. This could happen anywhere in New Brunswick. Anywhere in New Brunswick, at any time. Tant et aussi longtemps que les...
As long as the virus is active outside our borders and that we don't have a vaccine or a dependable treatment, this situation will likely happen more times in the coming months. This is a time to show understanding and forgiveness. Blaming and shaming may be a natural response, but it is not helpful. What choices can you make as an individual to protect yourself and to protect all New Brunswickers?
It is urgent that residents of Zone 5 seek testing for COVID-19. If people hide or ignore symptoms to avoid being stigmatized or ostracized, then the situation can worsen. We are focused on putting out the fire, determining who is carrying the virus and isolating them as quickly as possible to limit its spread further in the community. Contact tracing is taking place with officials reaching out to contacts to try and piece the puzzle together. And I just want to say a big shout out to the team up in the North Region. So l'équipe de...
The public health team that is doing the contact tracing right now is doing so much work, and I want to congratulate them. It's not just the teams in the north. They also have people giving them some support from elsewhere in the province.
Contact tracing right now, and I just wanted to give a big shout out to the whole team up there, the North Region, and also I think there's people from East Region public health teams that are helping as well, and they are really, really doing an excellent job. And the other partners that we're working with, the RHAs, Vitalité has been very, very cooperative and really, really forthcoming in terms of all the help that they can provide us with in this outbreak situation. Public health officials and our partners, including Vitalité Health Network, Extramural, AMB, 811, are working behind the scenes and setting up testing sites in Zone 5. Symptomatic people and contacts most at risk are our top priority for testing, followed by asymptomatic people. Information for general population testing is forthcoming. Je demande avec insistance aux résidents de la zone 5 de rester.
I urge residents of Zone 5 to stay home, in their home, as much as they possibly can. They must limit close contact to their 2-household bubble and maintain 2 meters of physical distance from others when they do have to go out.
Travel to the Campbellton-Dalhousie region in the past week should monitor themselves and their families for symptoms and seek testing if symptoms emerge. We are asking New Brunswickers to avoid non-essential travel to this area. I'm hoping that in the coming days, we will be able to turn the tide of this local outbreak. We don't actually know the extent of it yet, and so that's why we're being as proactive as we possibly can in terms of messaging to the public, making people aware of the situation. Nous mettons tous en œuvre.
We are doing everything we can to make that happen, but it is a lesson to all of us to remain vigilant against this disease.
All in this together, we really are all connected, and this type of situation highlights that fact. And so again, I want each and every New Brunswicker to take very seriously the steps that they need to take as individuals that will protect them, their loved ones, and the entire province. Thank you very much.
Good afternoon. Bonjour. Today, all 4 House leaders have agreed to adjourn the legislature until June 9th. This will allow the All-Party Cabinet Committee of COVID-19, MLAs, and government employees to continue to focus on the province's response to the pandemic, while still maintaining government services to the public. Also, it was not appropriate for MLAs from the Campbellton region to attend the legislature at this time. As we've heard from Dr. Russell, there are additional COVID-19 cases in Zone 5, Campbellton region today. It is likely we will continue to see more cases in the days ahead. This outbreak is a reminder that the disease is still with us, and we must all remain vigilant to ensure it does not overwhelm our healthcare system. Because of this ongoing situation, the All-Party Cabinet Committee on COVID-19 has made the difficult decision to delay the further loosening of restrictions in the yellow phase for one more week. Those loosening restrictions were supposed to begin tomorrow, May 29th. Instead, they will be delayed until Friday, June 5th. These activities include outdoor gatherings of 50 people or fewer with physical distancing, religious services of 50 people or fewer indoors with physical distancing, and low-contact team sports. This also includes the opening of swimming pools, saunas, water parks, gyms, yoga studios, dance studios, rinks, indoor recreational facilities, pool halls, and bowling alleys. These activities will not be permitted to protect everyone's This will protect everyone's health and safety. This will allow us time to see how widespread the outbreak is. Temporary foreign workers, which were a big issue over the last few months, will continue to be permitted, but they must self-isolate upon entry into our province and do so for 14 days. Today, we're extending the state of emergency order for an additional 14 days. This situation clearly shows that the emergency order is necessary. While most of New Brunswick is now in the first steps of the yellow phase of recovery, Zone 5 is in the orange phase. That means the people in the region that stretches from Saint-Jean-Baptiste to Baldoon must stay within their 2-household bubble. Personal service businesses and non-regulated health professionals are not allowed to operate in this region at this time. Les fournisseurs de services de santé non réglementés et les
Providers of non-regulated healthcare services and personal service businesses are not allowed to reopen yet. We're going to continue to monitor the situation in the days to come.
Officials are in the area to ensure compliance. Des représentants de travail sécurité
And the public health, public safety are in the region to make sure that people respect the law.
Concerns can contact our toll-free information line by calling 1-844-462-8387 or by emailing helpaid@gnb.ca. There will continue to be times like this as the pandemic continues, where some areas of the province are different than others. We will need to continue to be nimble and move back and forth between phases as needed to combat the virus. We are taking a number of measures to ensure this outbreak is as contained as possible. Our border restrictions are still in place and only essential travel is permitted. Les restrictions à nos frontières.
Border restrictions are still in place and only essential travel is allowed.
Officers are continuing to screen everyone who attempts to enter the province, and those who do not have a sufficient reason to be here are being turned away. Officers are following up on cases where people are permitted to enter the province but have been ordered to self-isolate for 14 days. For the most part, the system has been working well so far. We have a shared responsibility to keep everyone around us safe. Nous avons la responsabilité partagée d'assurer la sécurité.
We have the responsibility to protect the people around us. This current situation shows us what can happen when people are dishonest and when they don't take the guidelines seriously.
If further restrictions are required to contain the spread of COVID-19, we will not hesitate to put them in place. It appears in this case, the person that was involved chose to see patients after returning without following the rules of public health. Information have been passed along to the RCMP to determine exactly what took place and whether charges are warranted. I know many people have questions about professional ramifications, but this must be left in the hands of the professionals. All that I can say is that it is a human resources matter, which will be addressed by the individual's employer. I'm confident they will take the appropriate steps after the appropriate investigations are complete. I know this person is not even remotely representative of the many responsible healthcare professionals who are doing their part to help New Brunswickers. The emergency department of Campbellton Regional Hospital is closed until earlier next week due to the higher risk of transmission of COVID-19. Non-urgent or elective healthcare services at the hospital have also been put on hold. For now, patients seeking emergency care should call 911. They will be taken by ambulance to the nearest emergency department. I know many healthcare workers in Zone 5 and their families are concerned right now about their potential exposure to the virus. Je sais que plusieurs travailleurs
I know that many healthcare workers in Zone 5, as well as their families, are concerned because they could have been exposed to the virus.
the right thing by getting tested and self-isolated until they have the results. Le travailleur de
Healthcare workers in Bathurst could be asked to see additional patients while their colleagues from Campbellton can't work.
I want to thank the many professionals in the healthcare field throughout our province who have been working tirelessly throughout this pandemic. They've been doing their part to keep us safe, and I don't want anyone to think the actions of any one person reflects poorly on any particular worker or worker's profession as a whole. They do not. Our healthcare workers will continue to play a key role in helping the region contain this outbreak. I mentioned yesterday that everyone should have a community face mask with them when they are out in public. Whenever you find yourself in a situation where physical distancing is not possible, you need to wear your mask. We can help protect everyone around us by wearing a mask when close contact with others is inevitable. That means when you're in an indoor public space, you need to have a mask with you. Our focus is always, as always, is on containing the virus as much as possible. Nos efforts comptent
Our efforts, as always, aim to contain the virus as much as possible.
to act quickly to accomplish this goal. This situation is a reminder of how important it is that we all do our part. Cette situation
This situation reminds us that it's important for everyone to do their part.
to listen to the advice of public health and continue to obey the emergency order. Each of us has a role to play to keep all of us safe. Together, we will recover from this little setback, and together we will put New Brunswick back on track to its recovery. Thank you. Merci.
Merci, Monsieur le Premier ministre et Dr. Russell. Thank you, Dr. Russell and Premier Higgs. We'll now proceed with questions from the media. Each reporter will have one question. Have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question cet après-midi. Silas Brown, Global TV.
Hi there. This is for Dr. Russell. We've heard now that as many as 150 people may have come into close contact with the individual at the center of this new cluster. Should we expect to see cases popping up around the province outside of Zone 5 in the coming days? And if that is to happen, at what point would we see restrictions reimposed around the rest of the province?
Well, we have a lot of contact tracing to do right now, Silas, and certainly anybody who has been in that area or in contact with people from the area in the last 14 days obviously should be on high alert. The testing that we're going to be doing in the next several days will reveal a lot of information about cases in the zone. And also, again, if people are vigilant around the province who have either, as I said, been in contact with somebody who has been in that region in the last 14 days or have actually been in that region themselves in the last 14 days. I think we're going to get a lot more information. In terms of triggers right now, the only reason that we went to orange in this particular case was because we have such a large number of contact tracing to do, because it involves a healthcare facility and obviously healthcare workers. So just being very, very aware that, again, needing to close the hospital in that region right now, we need to look at all the things that need to be done in this situation right now. So far, again, we've had many, many calls to 811. I think about 219 referrals for testing, et cetera. And so we're doing a lot of testing, and we will continue to do that. We have great capacity to do that. But you are correct. We could see some transmission around the province, again, if people had traveled to that area and had close contact. And by close contact, I mean being within 6 feet of somebody for 15 minutes or longer without having worn a face mask. So those are the people that we're most concerned about right now, and those are the people who are being contacted. And each new case that we find, we will do more contact tracing around each case. We want people to get tested who have symptoms, obviously, so we need people to be symptom watching. We need them to be very, very vigilant and have a low threshold for getting tested. In some cases, for those people who have had very close contact and don't have symptoms, we are testing them now, but that doesn't mean that they don't have to continue to self-isolate for the entire 14-day period, because as you know, the testing just represents a snapshot in time, so they could test negative today, but tomorrow or the next day they could test positive. So we really need people to self-isolate who are being told to self-isolate at this point.
Thank you, Doctor. Thank you, Mr. Brown. Andrew Watt, Telegraph Journal.
My question is for Dr. Russell. Dr. Russell, when this all started, I asked you a question about the information that was being given out about the people who had become infected. Now, I also spoke to the Ombudsman of New Brunswick about this. This seems to be a situation where there's been a lot of contact with a lot of people. Why aren't we getting more information about who this person is? We know that it's a male, we know that it's a healthcare worker who worked at the Campbellton Hospital. Are you prepared to tell us more, and if not, why not?
Well, I have the same answer that I've had throughout the entire pandemic, and it'll continue to be the same. When public health does its investigation, we reach out to the close contacts and contact them individually and get them to self-isolate for 14 days, and if they develop symptoms, they get tested. For those people who are not as close contact, they are told to self-monitor. If there's been an institutional type setting, then we do a risk assessment based on that. In this particular case, we have lists of contacts with respect to the healthcare workers involved in terms of being able to trace those contacts. If there was a public exposure where we didn't have the names and phone numbers of those people, I would be telling you right now, if you were in XYZ place at this date and this time, then yes, you would get that information publicly. But at this point in time, because we have access to the information, we're protecting people's privacy at this moment in time as much as possible, and again, protecting the public. So we always have to balance those two.
Thank you, Doctor. Thank you, Mr. Watt. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for the Premier or Dr. Russell. You've asked New Brunswickers to not visit Campbellton region for the time being, but we're also hearing concerns from New Brunswickers that they've recently come into contact with people from the Campbellton region who are visiting their area. Are you asking people from Campbellton to return home if they are on a staycation for the time being?
We're telling them to call 811 and get tested if they're concerned, and to self-monitor if they think that they have come into close contact with a known case. Then they technically should be self-isolating. Where they choose to do that is up to them. Obviously, they should do it in a place where they can isolate safely, and people in their homes can wear masks and not have to share a bathroom and not have to share a bedroom. We are recommending just only essential travel at this point to and from that area. So that's the advice at the moment in time. But with respect to if somebody had been there and they feel the need to get tested or self-isolate, they can do that where they are if there's no risk to the people that they're with in that household. But obviously, we're looking for people to make sure that they watch for symptoms. But 811 is aware that there would have been very many people who may have come into contact with people that have tested positive in Campbellton, because we do have 6 cases there now. We do expect more, and so those people can call 811 and get tested.
Thank you, Ms. Hogarth. Thank you, Dr. Russell. Michel Corriveau, Radio-Canada.
Michel Corriveau, Radio-Canada. The question is for Dr. Russell. We've heard that there have been 2 healthcare workers who have been confirmed with COVID-19. Inaudible question. Answer. We don't know the exact number just yet, but they can continue to go up as we identify more positive cases. Currently, there are 6. 2 of them are healthcare workers. So the close contacts that we have currently can increase as we identify new cases. Gilles Lantaigne said in an article that there were about 150 contacts, but I believe that the number of contacts will increase as we identify positive cases.
CBC.
Hi there, my question is for Dr. Russell. Were any of the new cases you mentioned today a healthcare worker, and did this person also work at the hospital?
So 2 of the 6 cases that are positive are healthcare workers.
And did they also work at the hospital, both cases?
I just wanted to, the type of information that we were releasing right now is that they are a healthcare worker. We have the lists of contacts that we need to trace, so we're working on that.
Thank you, Ms. Fraser. Thank you, Doctor. Isabelle Larose, Radio.
Isabelle Larose, Radio-Canada. Isabelle Larose, Radio-Canada.
Star.
Hi there, it's a question for Premier Higgs. Premier Higgs, just in light of some of the legal challenges that are being mounted elsewhere, why is it important to maintain restrictions on New Brunswick borders? And I've got a follow-up to this too, if I may.
Might as well say it right now quickly.
Well, follow-up is, do public health concerns trump the charter mobility freedoms?
Premier.
I think the rationale behind border protection has only been reemphasized through the events of this past week. We do know conclusively in this situation that it did start from a cross-border, a travel-related case from outside the province. So given that known fact, it reinforces the need for us to protect our borders and do so as long as the pandemic is in different phases in different provinces. I'm sure that, I'm obviously optimistic and very hopeful that these cases will we'll be able to do the appropriate contact tracing and get certainly a handle on this, but it is very concerning. I think in all cases in our charter, health and of concern of our citizens is certainly one of those areas that carries a lot of weight constitutionally and legally. And right today, we have seen enough around the world and across our country of the tremendous impact it's had on lives, on our economy, and I don't think there really should be much argument that there's still a need to be very, very cautious and a need to follow the rules closely and protect our borders are one of those rules that we currently believe is necessary.
Thank you, Premier. Thank you, Mr. McKinley. Adil Ibrahim.
Thank you. This question is for Dr. Russell. Health Canada reports that New Brunswick has been testing an average of about 1,900 people per week in recent days. Dr. Russell, you had suggested the goal was 2,300 per week, and back in April, the province was testing around 3,000 people per week. What is the reason for the decline? What is the optimal amount, and is enough testing being done in New Brunswick now?
That's a good question, and I have that conversation pretty much every week with our epidemiology team. The goal of the 2,300 a week was really to be confident in our data around our cases, but The tricky parts about testing have to do with if there really, really are not very many cases or no cases at all, and you test too much, your positivity rate changes, and that can affect your data as well. So you can get false positives in that case. So it's really a balance between what the prevalence is in the province when you are looking for cases. But the philosophy has always been test the right person at the right time for the right reason. So we've expanded our symptom list to make sure that everybody who has 2 symptoms on a list of about 9 or 10 symptoms can call 811 and get tested. So again, making sure we have access, making sure we have the ability to provide people with their results in a timely manner, and making sure that we have the human resources as well as the supplies are all part of this testing strategy at the moment.
Thank you, Ms. Ibrahim. Thank you, Doctor.
Thank you.
Margot Castader-Akobari, Radio-Canada.
Radio-Canada. My question is for Dr. Russell. If you could answer in French on contact tracing, how are you doing contact tracing in this area? Answer. Like with every outbreak, public health nurses and sometimes other personnel helps them. People in the region or other regions can come and help. So there are many public health nurses that are working on contact tracing right now. They have contact lists for people who were exposed to this healthcare worker. And as they get the names and phone numbers, they reach out, and at the same time, we do testing. We have increased our testing capacity in the Campbellton region, and this will also help us. This will help us identify positive cases quickly. People who have had close contact with confirmed cases will be told to stay home for 14 days.
Journal.
Thanks, Bruce. Dr. Russell, the 3 MLAs from the Campbellton region say they will get tested for COVID-19, but they've already interacted with their caucus colleagues and then sat in the legislature. I wanted to know if you're advising all MLAs to now get tested, or if they need to self-isolate. And Premier Higgs, have you been tested, or will you now be tested?
So with respect to advice to anybody who is in the Campbellton region currently, or who has been in the Campbellton region, or has been in close contact with someone from the Campbellton region, people can get tested. With the contact tracing we're doing, if you don't receive a call from public health, that means you were not in close contact with somebody who is a diagnosed a case officially. So we're telling those people to self-monitor for 14 days. So the same advice that I would give to the public, I would give to MLAs. And my understanding is the situation in the Ledge is that the whole, for any situation, whether it's a business, whether it's any kind of organization that is operating in the yellow phase, they have to ensure physical distancing is possible. People have to wear masks if they can't socially distance or physically distance. So again, all of the information that we provided yesterday during the press conference in terms of advice to the public would be the same across the board. So whether you're an MLA or you're a member of the public, all people are given the same advice. So everybody should be watching for symptoms. And again, anybody who has not been in close contact, meaning you're not less than 6 feet apart, and you've been in close contact with somebody for 15 minutes or longer, then those are the people who will be contacted by public health to say, you have been in contact with a case and you should be tested. But we are offering testing to people in the region. And again, we know that there is asymptomatic transmission, and we have offered that as an extra measure. But we also know that a person who tests negative could develop symptoms and test positive anytime during that 14-day period, because that's the incubation period. And so again, I give the same advice whether you're a doctor, a lawyer, an MLA, whoever. All the advice is the same in terms of what the close contact means and who should get tested and who shouldn't get tested. But we have offered that to people in the Campbellton area or people who have come into close contact with people in the Campbellton area.
Premier?
So in my case, I haven't been tested at this point. I don't have any of the or symptoms to warrant testing. But I guess what I would like to also state is that my three colleagues that from the north that felt it was appropriate for them not to be traveling to and from the legislature, I'm not aware that any of them have symptoms as such, but there was concerns from my colleagues in the Ledge, concerns particularly from those from the north and the association. But I think what I'd like to emphasize is we were extremely cautious in the legislature to follow all of the social distancing practices, to wear masks, to use hand sanitizer, to be taking temperatures when we come in. So it wasn't as a result of saying that we can't operate here in the Ledge as such. It was a case where three of the members felt that they should not be traveling to and from the region that's now moved back a phase, and also that we were from all aspects of the province. So the point for us is that we will take the 14-day window. That gives ample time to look for any issues or any concerns, and including from our colleagues that are from the north. And then we'll reassess then the value to reopen the Ledge. In the meantime, we'll continue to have the COVID Cabinet Committee. We'll continue with all the activities that are ongoing, that, our daily routine that's well outside of the legislative process. So life doesn't stop because the legislature's not sitting.
Thank you, Premier. Thank you, Mr. Harris. Mathieu Roy-Como,
Mathieu Roy-Como, Acadie Nouvelle. My question is for Dr. Russell. Among the new cases, one person was 90 years or older. Knowing that many contacts were identified, is there any reason to be concerned for care facilities in the region? Answer. Residents in long-term care facilities are a concern at all times during this pandemic because they're a vulnerable population. We worry about vulnerable populations throughout this health crisis. As we are doing contact tracing, if there is someone in a long-term care facility that is identified as a close contact, we will take the measures necessary to protect those residents. But at this time, I have no information that points to the fact that any care homes would be affected at this time. It's still possible, but at this time, it's not the case. Throughout this crisis, we have been concerned about protecting all vulnerable populations. Charles Camiran, TVA Edmundston. My question is for Dr. Russell. Yesterday, you mentioned that anyone from outside the Campbellton region who had gone to that region should monitor their symptoms. Have you identified a specific date for which people involved should consider with their 14 days? So anyone who has gone to the Campbellton region must self-isolate for 14 days. Do you have a start date? Or does it just apply to anyone who visited in the last week? Answer. The date where there would have been transmission would have been between May 13th and 15th. So if you were in the area during that time, it's possible that you've been in contact with someone who has since been confirmed positive. But I would say starting now, self-isolate for 14 days. In those 14 days, we'll see how many new cases will have been caused by that first case. This means that people in the Campbellton region now are in the orange phase now, because we want people in that region to stay home as much as possible and to stay there while we investigate on contacts. anyone who has been there or who's been in contact with someone from there, I would say monitor your symptoms for the next 14 days. Jean-François Boisvert, Acadie Nouvelle. The question is for Dr. Russell. How long can we expect the Restigouche region to be in phase orange? Is there a specific number of days without new cases that we can aim for to lift restrictions? Or could it be any faster with a consensus with public health and the government? Answer, it's an excellent question. Normally, to see how the number of cases will be affected in this outbreak, we certainly need 14 days to understand how many people will test positive. But in those 14 days, if everyone who's supposed to stay home has no contact with other people, maybe we'll see cases go down. But we don't know anything for certain. So I would say it would take more than 14 days. We'll have a good idea of the situation in the next 2 weeks, but sometimes it takes a little bit longer than that to understand the information and decide to lift restrictions.
CTV.
Hi, Premier. Is this individual, this healthcare worker, is this individual still employed by the province and or by Vitalite Health Network, or has he been suspended?
So I don't think that's a question that I can answer. Actually, it is up to Vitality. It would be an HR issue. What I do know is that all of the issues around this case are being investigated, and I'm sure the management of Vitality will deal with it appropriately. At this point, I haven't received any report in relation to the employment status. Maybe one will be forthcoming, but I wouldn't necessarily receive it in any case. But what I do know is that the situation is being thoroughly investigated.
Thank you, Premier. Thank you, Ms. Brown. Edouard Rodriguez-Quillebage, Radio-Canada.
Radio-Canada. Isabelle Larose, Radio-Canada. Éloise Rodriguez, Radio-Canada.
Hi, Premier. Today you've announced a pause on the planned loosening of some restrictions for the yellow phase. I'm just wondering, can you just recap quickly, I guess, what is still in effect versus from last Friday? Is there any changes from last Friday? And also, what exactly would it take for us to go backwards to the previous phase like we've seen in Zone 5? Sorry, I'm realizing that's probably not for the Premier, for Dr. Russell.
Maybe, yes.
So I don't have the detailed list in front of me of what was supposed to happen today, but I do know it was gatherings of 50 or less, and with physical distancing, church services, yoga, sauna, pools, low contact sports is the list that I can remember off the top of my head. So if there are extra ones, I can get Bruce to contact you with the rest of that list. In terms of triggers, so we have 3 categories of triggers, and you have to have a couple, 1 or 2 from each of those categories, at least 2 out of the 3, I think. And so one of those categories is the epidemiology, so the type of transmission of cases, the number of cases, how quickly the numbers are growing. Those are the types of things on the epidemiological side. And the one that we've talked about the most, to go back to red, would be 3 unlinked chains of community transmission. And those types of transmission of cases are the ones that cannot be traced back to a travel-related case. So, and that would have to happen in a 6-day period. And so that would be very extreme to have that situation. So we're not expecting to see that type of situation. That's one category. The other category includes public health criteria. So can we do contact tracing? Can we do testing? Do we have testing supplies? Do we have human resources to do the testing and contact tracing? testing, et cetera? And also, do we have the compliance of the public in cooperation with respect to understanding, education, and awareness around risks and behaviors? And then the third category of triggers are the hospital triggers. So do we have enough hospital beds? Do we have enough ICU beds? Do we have enough ventilators? Do we have a large number of healthcare workers that are infected? So these are also triggers that we look at, and it's a combination of those three categories of triggers that we base our risk assessment on when we go forward or backwards.
Thank you, Doctor. Thank you, Ms. Odd.
That concludes today's update. Ça termine notre mise à jour. Merci beaucoup.